Today's lecture is on irreversible hydrocolloid, or better known as alginate. When we take an impression on a patient's teeth, the impression is a negative reproduction of the dental structures. When the model is created with gypsum, that becomes the positive reproduction. There are three classifications of impressions, but we're going to focus today on the preliminary impression. And preliminary meaning prior to anything being done to a patient's teeth. So preliminary impressions can be taken by the dentist or the expanded dental assistant or a DA2 or CDA. They're used to create diagnostic models. Most people refer to them as study models. The impression trays are a stock tray. They come in different sizes, lengths, and widths. We have to try those trays in the patient's mouth to see what size they will need. These trays are metal and they're perforated, which means they have holes in them. That means they're used for preliminary impressions, and we do not need an adhesive to hold the material because the material squeezes through the little holes, and that's what holds it in the tray when it's removed from the mouth. The correct tray for a patient should be comfortable. It should extend beyond the facial surfaces of the teeth. So when it's tried in, it should go further than the facial, 2 to 3 millimeters beyond the third molar. So we have to try the trays in the mouth, and we have to look into the mouth, the patient's mouth, to see if it's covering all these areas. If it's not and you want to extend the length, you can add utility wax to the border of the tray to cover the third molars, which is this area. If a patient has a high palate, you could actually put wax in this area. So you can make it longer or make it higher. So what does hydrocolloid material mean, alginate? Hydro means water, and colloid means a gelatin substance. Irreversible hydrocolloid materials can not return to the sol state after they become a gel. So that's why they're called irreversible. Once the water is added to the powder, then it's a gel and it cannot go back to the sol or the solid state. So let's look at the chemistry of the alginate for just a second. The main ingredient of the alginate is potassium alginate, and that's derived from seaweed. This is what causes it to thicken when the water is mixed with the powder. Same thing that you have as in some ice creams that causes them to thicken. The strength of the alginate is not very strong. Therefore, we need to be careful. We need to try to do all that we can to keep it from tearing when you remove it from the patient's mouth. So the strength in the material will continue to increase even after it appears to be set. So leaving it setting for a little bit longer is a good thing. We should not remove it from the mouth too quickly. So alginate can be purchased in cans or pre-measured packs. The shelf life is approximately 1 year, so we cannot keep alginate over a year in a storeroom because the particles become too large and it becomes lumpy. Most alginate impressions need to be poured within 1 hour after taking it. Now, these are 2 words that you need to know. You need to be able to use them correctly. You need to be to understand them. Imbibition: if an alginate impression is stored in water or in a soaked paper towel, it will absorb the additional water and expand. So that changes its dimension, so it would not be correct for the dentist to look at. So imbibition: it takes up water. It's like a sponge. Syneresis: if it remains in the open air, then the moisture will evaporate and cause the impression to shrink. Alginate is available in 2 setting types: normal set alginate, some people refer to it as regular set. The working time is 2 minutes and the setting time is 4.5 minutes after mixing. The fast set alginate, the working time is 1.2 0.25 minutes and a setting time of 1 to 2 minutes. Now, what is working time? Working time is the time that's allowed for mixing, loading, and positioning the tray in the patient's mouth. So the normal set working time of 2 minutes and a setting time of 4.5 minutes. So within 2 minutes, you should be able to mix, load, and position the tray in the mouth. The fast set alginate, the working time is 1.25 minutes after the setting of 1 to 2 minutes. So you see that the working time and the setting time is different. The 4.5 minutes includes the 2 minutes. So we have to move very quickly with our alginates. The setting time is the time required for the chemical action to be completed before removing from the patient's mouth. So once it's mixed, loaded, and positioned, we have to leave it in there for the amount of setting time so that it will not tear when it's removed, so it can go through its chemical reaction. So let's think about the water. Room temperature water is best when mixing the alginate. If you want to make the alginate, if you want to increase the setting time, so in other words, you can work with it longer, you need cooler water. If you want to reduce the setting time or make the material set up faster, then you need warmer water. So cooler water increases the setting time, okay? So that means you can work with it longer. The warmer water will reduce or shorten the setting time, so that means you have less time to work with it. So the water to powder ratio is very important. For the adult, we've learned in lab that 2 scoops of powder and 2 measures of water for the mandibular and 3 for the maxillary. When you get out into the offices and you get a job, you're going to have to make a decision based on the patient's size of their mouth. If their mouth is very large, you may need the 3 scoops. If they have a real small, tiny mouth, then you're going to need to judge. You may not need but 2 scoops on each one. So most people mix alginate with a bowl and a spatula, just like we're doing in lab. However, there is another way to mix alginate, and it's with an electric mixer. As you can see here, here's the rubber bowl when it's connected to the mixer. This whole unit is called an alginator, and some people have these in their offices. We have one at MCC, and you actually put your powder and water in here, turn it on like an electric mixer, and use the spatula to mix it. This actually turns it for you instead of having to turn it in your hand. So it's called an alginator. We always need to tell our patients what we're going to do to them. Now, we're not worried about that with the mannequins in lab, but you need to realize that when you work with live patients, you need to tell them what to expect before you do something to them. So before taking an impression, you want to tell them things like the material will feel cool because you use cold water. There's no taste to alginate really, and it will set quickly. They can take deep breaths through their nose if they feel like they're a little bit like they want to gag, or if it's bothering them, breathing through the nose is good. Tell them if they have any problems, just raise their hand and let you know. So when we take the impression and we look at it, we need to evaluate it before we take it to our doctors to let them look at it. So let's look at some things that we need to think about. The impression tray should be centered. That means either the handle should be center of 8 and 9 or either 24 and 25, depending on which one you're taking. There is a complete peripheral roll. Now that's the roll around the edges of the impression. So it should not be overseeded, which means it will make holes in the occlusal surface of the teeth. However, you do have to be sure to seed it enough that you're getting the teeth. So the impression should be free of tears or voids, so voids meaning holes, and it should have detail of the teeth and the soft tissues. So when we look at the impression and we evaluate it, we should have on the mandibular, we should have called the retromolar area, the lingual frenum, the tongue space, and the mylohyoid ridge. So if we look, this is the retromolar area here on each side, and as you see, We have the distal of the last molar, and we have this space here. We have a nice area for the tongue. We have the tissues. This is the peripheral roll around here. And we also have the mylohyoid ridge there. So on the maxillary, we want the hard palate, which is here in this area. We want this, and we also want the soft palate. We want all of this hard palate here. The soft palate is back in this area. If you get to the soft palate, you're going to gag people. So this is the hard palate area, and the tuberosities, which is lingual to the last erupted molar. So this is the tuberosities. So these are things we want to look at. Are there any holes in the occlusal or the incisals of the teeth? Any voids? No. Everything looks nice. Are the facials there? Does it look like we hit the teeth anywhere? Do we have any of the trays showing anywhere? No. So these are nice impressions, and this is what you need to learn to evaluate when you look at your impressions. So lastly, this is just a slide that I added, make some things that may not be in your textbook. This is just fast set. I just wanted to show you where to look at on the can. It can say regular or normal set. This is fast set. Typically alginate is white, but it can come in color. So this is a pink fast set alginate. This is chromophase. Now what this means, chromophase and chromopan, it means they go through different colors. So they may be pink when you open the can, and when you mix it with the water, when that 2 minutes of mixing time is complete, it will turn to a white color. And then once you place it in the mouth, it will turn a certain different color. It may go back to pink, or it may be white and turn pink and then go back to white. But it's colored so you will know your time. So that's an option. It's a little more expensive, but some people like it and they use it. The chromopan can actually be poured a little later than an hour. Now this is something you've not seen yet. These are rolls. This is a catalyst and a base. Think of it like a powder in the water. So this is actually put into a machine and push the button, and it mixes it for you. Now this is not alginate, but it's a type of material that can replace alginate for an preliminary impression, and you will see that type thing later. I hope you have learned from this PowerPoint. If you have any questions, be sure to let me know in class or in lab. You can let your instructors know. We'll try to answer your questions.